Let's go to the front line fight against coronavirus. We've got CBC's Megan Fitzpatrick standing by live outside a hospital assessment clinic in Oshawa, which is east of Toronto. And Megan, I know you got to look at how doctors and healthcare specialists are treating patients, how they're screening for this virus. So how does it all work?
Well, we learned, Suhanna, that a lot of the assessment is actually done by telephone and online first before they physically come to this COVID-19 assessment center clinic that has been set up here at this hospital. So they fill out a form online, for example, they take information over the phone, and they use that to kind of triage people to determine if they need to come here in person to be physically assessed by the doctor. So if a patient is told to come here, they are given a specific time to come. They don't want big crowds of people coming here all waiting in a waiting room or anything like that, Suhanna. So they're told individual times to come to the clinic to be assessed, and once they arrive, they are given a mask before they go into the assessment room. Before the doctor or nurse goes in there, they gear up. They're given or they put on a gown, they put on a mask, they put on gloves, and then they go into the room with the patient and do the assessment. If it's determined that they need a test for COVID-19, that is administered in that room there. Those are those nasal swab test kits that people may have seen. And the doctor who gave me the tour of the assessment room, Dr. Dan Ricciuto, he did acknowledge that there is dwindling supplies of those test kits in Ontario. And so he talked about what the hospital is doing to sort of conserve those tests and how they're deciding who to test and who not to test. Not everyone is getting a test that wants one. We also talked with him about the capacity in general of Ontario's healthcare system to cope with COVID-19, especially in light of what may still be yet to come in terms of the number of cases. Here's what he told me about the capacity of the healthcare system and some concerns he might have about that. Take a listen.
This is where that conversation about flattening the curve comes into play, where we need the public to perform these social distancing measures. If we see the patients getting, or people getting sick all at once, that will overwhelm our system. Even if we can flatten the curve, I think we will be at or above capacity for a long period of time. So it's definitely a concern that all of us have.
And we talked too about the capacity for Ontario's labs to be doing the tests, Suhanna, that are sent to them. He was telling me that earlier on in this, test results could be turned around in about 24 hours, but these days it's more like 3 to 4 days. And he did say he knows the provinces is working on that. They're trying to increase capacity. So he says that he hopes that happens soon so that people aren't waiting more than a day to find out if they have COVID-19 or not.
And what did he say about working right there on the front lines, Megan?
Well, he said it is kind of a stressful time for people like him who are working on the front lines. But he also talked about the precautions that he's taking, that people in the clinic are taking to keep themselves safe. But he also did have a message for the public. We've been hearing this from some other healthcare workers. I've seen some images online, Suhanna, of healthcare workers posting signs saying, "We are staying here for you. Please stay home for us." Here's what Dr. Ricciuto said about that.
All the messages you see about social distancing, I think, are very important and can't be underestimated. It is something that will prevent the spread of the virus. This is why, as much as we can do with respect to self-isolating, staying at home, using good hygiene practices, including hand hygiene, are incredibly important.
And Suhanna, he has tested people at this assessment clinic that did end up testing positive. He says he's not worried about transmission, though. Again, he took all the proper precautions to keep himself safe. But he also did say there are several patients hospitalized currently at this hospital in Oshawa who have COVID-19. So again, he's urging the public to listen to that message he just told us about self-isolating if you have symptoms, staying home if you're sick, and again, just engaging in that social distancing. He said it's so crucial to keeping people like him safe and everyone safe during this time.
Absolutely, and we'll chat again. Thanks, Megan. CBC's Megan Fitzpatrick. She is in Oshawa, Ontario.